Malaysia today reported 1,103 new Covid-19 cases, with 49.3% of the new cases being detected in the Klang Valley region. Kuala Lumpur alone reported 392 new cases, with Selangor reporting 150 cases. The Klang Valley is followed by Sabah, which reported 288 new cases. This brings the number of active cases in the country up to 12,601. Meanwhile, the Health Ministry also reported 4 new deaths attributed to Covid-19, all in Sabah. In Kuala Lumpur, the Tapak Bina Damanlela cluster, linked to a construction site in the city, saw the largest number of new cases, with 385. This cluster has 1,132 cases to date. The sudden spike in the new cases in Perak was due to the Tembok cluster, with 111 new cases, which originated from the Alostar prison in Kedah. The number of new cases attributed to the Hentian cluster, which has spread across the Klang Valley, originated from the Kajang bus station, had increased by 83.
We are taking all the public health measures to contain and to curb the spread of the infection. More importantly, we do know the option of MCO or CMCO. Why? Because we need to strike the right balance between health and economy, strike the right balance between life and livelihood. So the only best justification for this and strike this balance is adopt the CMCO. Because if we were to implement the MCO, the cost of the impact of the economy is very high. So that's the reason why we opted for CMCO, but we need to balance it out. But more importantly is the collaboration and of the onus is on each individual if they can comply to the SOP, particularly the social sectors. Economic sectors, we know that because we want to allow the economic sector to continue to function, and but the social sector we can control. So if the public can control and help the Ministry of Health to break the chain of infection. If possible, stay at home.